Hi everybody, welcome back to our second video. Thank you so much for joining, subscribing, liking. Welcome to All Things PSW with Winnie. If you have not already, please be sure to subscribe, like, and share with your colleagues. I also truly appreciate all the feedback that you have sent me. I will definitely take everything into consideration. I will also be posting more videos because that's definitely what I do see in the comment section. So please just give me suggestions as well. I'm very open to feedback. And the final thing that I wanted to discuss that some people have asked me is about interview skills, resume writing. If you feel that this is something that may be helpful, let me know. What I can do for the interview skills is I can give you a scenario or give you some examples and allow you to ensure that after you pass your exam that you achieve job success. So let me know if that's something that you're interested in and I will definitely add that. So now we're going to get into our next video. I do have a few questions that we are going to go over. Again, if you are confused or you need additional assistance, please be sure to contact PSW Exam Preparation. We are based in Canada and we have multiple instructors who are here to help you. We provide test questions, mock tests, but we also do one-on-one care. So if you really feel that you're having a difficult time, I would rather you come to us before you fail the exam. But of course, we're not going to fail. So, okay, let's get started. So the first question that we have is, what would you expect to see on an ADL checklist and flow sheet? A, hygiene, food and fluids, and elimination. B, recording information about care that is given, a client's response, and the client's activities. C, goals and interventions based on the assessment. And D, details about a patient's physical, emotional, social, and cognitive health. The correct answer is A. So let's talk about an ADL checklist. What is it exactly? An ADL checklist is something that records your actions. Things that you do when you are a PSW, your implementation, your activities. If you remember ADPI, it was that nursing process where we had the assessment, the diagnosis, the planning, the intervention, and the evaluation. But when we talk about this, we're talking about implementation, which is the I. So this is where you record what care you gave to Mr. Smith. What food did Mr. Smith eat? What fluids did Mr. Smith get? Was he walking? Did he use a walker or did you wheel him? What activity did he do? Did he exercise for 10 minutes, 20 minutes? Did you help him with range of motion? Was it active? Was it passive? Or was it active passive? And then you also record the elimination. If he has a catheter, did you measure the catheter amount? Did you log it? Did you measure the input and did you measure the output? All these things are a part of that. When we talk about the progress notes, this is where you record information about care you give. So you document, for example, in 24-hour format that you provided care. You're now documenting maybe at the end of your shift. This is what happened throughout the shift. So you're just talking about the activities that happened and the client's response. A care plan is what is actually brought together by different disciplines. So different disciplines have the ability to come and discuss several things and say, we're providing care for Mr. Smith and this is what we feel he needs at this point, etc., etc. So these are the types of things that will be put in the care plan. Does he need exercises? What is the care that he is need? This is always, well, not always, but typically an interdisciplinary or multidisciplinary approach, which means a lot of people come together to figure out the right care for the patient. Last but not least, are data forms, and these are just details about someone's physical, emotional, social, and cognitive health. So if we look here, guys, the correct answer, like we said, was A. So B is not right because this is recording information about the response. We already said that that is a progress note. C is goals and interventions. That is a care plan. And finally, D is a data form. So the right answer was A. Number 2. Who focuses on rehabilitation and adaptive equipment for ADLs? So when we speak, guys, sometimes in the exam, I've heard people tell me that they might not get the full letter. So for example, they'll get OT, NP, RT, PT. And if you don't know what this means, you're obviously not going to get the answer correct. Sometimes you will say occupational therapist, OT, but I want you to learn these particular acronyms so that you're not stuck when you're writing your exam. So let's keep going. So A is the OT, which is the occupational therapist. B is the NP, which is the nurse practitioner. C is the RT, which is the recreational therapist. And D is the PT, who is the physical therapist. So remember, if you read the question, always try read it 3 times over. So their focus here is rehab or rehabilitation and adaptive equipment. The right answer is A, OT. So what does an OT do? An OT focuses on teaching patients how to perform ADLs, rehabilitation, and adapts equipment as well. So an OT is very helpful for someone who maybe moves to a new apartment. For example, in my role, a lot of people move from the community and their home, and now maybe they're in a retirement home. What we do is we send occupational therapists to assess the area because we want to make sure that maybe they have the grab bars in the bathroom to prevent any falls, and that the wheelchair has been measured if they need one, that the walker has been adjusted to their height. And also to understand what equipment does this particular person need? Do they need bed rails? What other things to guide them? They also have things such as the ones that help you, like shoe horns to put your shoes on. Sometimes you also have something that helps you put your zipper up. All these things are types of equipment that an OT would recommend. NP is someone with an extended scope of practice as a nurse. So I am just a nurse. I have a master's, but I am not a nurse practitioner. A nurse practitioner is someone who takes these particular courses and they actually write an exam. Once they pass the exam, they're now a nurse practitioner. They can diagnose, they can prescribe, but only simple injuries and illnesses. Okay? So they diagnose, they treat. It's just that advanced education, like we said. RT, if you look at the word recreation, think of recreation when you take your children to the park or for games or for swimming. Recreation just means activities. So if you have a RT, this is somebody who kind of has some quality of life improvement in activities such as leisure, dance, music, canasta, bingo, ping pong, whatever the case may be. They're probably the ones that are responsible for arranging these particular things. And the last thing is the PT, which is the physical therapist. Their focus is on restoring function. Their focus is on preventing disability. So you can have physical therapy for a lot of things. You can even have physical therapy for your brain. We call that vestibular physical therapy. Let's say you have vertigo or some type of dizziness, they can help you. But the physical therapist that we mostly think about is for people who maybe had a fall, or people who are in a car accident and now they need help with moving. They're trying to regain their mobility, regain their strength so that they're able to move and adjust to their new situation. So that's why it's a restoration of function and also to prevent any type of disability. Next question. Alternative health practices are treatments that differ from standard medical practices. True or false? So the answer is true. If I take any alternative health practices, this is different to what is considered standard. Standard means that's what is given to the norm. This means that if I go to my physician, I am going for a standard medical practice. But let's say I do not want to take the blood pressure medication that my doctor has prescribed. I want to try a supplement, for example. Let me call a naturopath. I will then be going into alternative health practices. Other examples are acupuncture, massage therapists, herbal medicines. All these things are alternative. I could, however, in conjunction with standard, combine the two, and this is what we call complementary because one is helping the other. So you have to understand that some people do not agree to standard medical practices. This could be cultural, but it could also be religious. So if people choose to do any type of alternative health practices, you have to treat them with dignity and respect their decision and not judge them and say, well, you should just take the medicine. There are a lot of different reasons and contexts that come into going into standard medical practices. So it's very important for you to know the difference. Next question. Ethics includes the fundamental principles of behavior that one thinks is right or wrong for him or herself. Again, I will say it again. Ethics includes the fundamental principles of behavior that one thinks is right or wrong for him or herself. True or false? The answer is false. So it's important to really know this chapter. It's a very difficult chapter to grasp. It's a chapter that you might have to look over at least 3 times to understand the difference between ethics, morals, values, principles. All these things are important. So what are ethics? Ethics are the rules of conduct that guide you to decide what is right or wrong. Many institutions have guidelines. So for example, every organization I've worked at usually had an ethical committee. They would sometimes ask, do you want to join it? But they used to also have an ethical framework. A good example is the ideas framework where, you look at a situation and you try to guide yourself to know, should I just go to my supervisor? Should I go to my colleague? Or should I go to the ethical committee to bring this forward? Right? So these are just the rules of conduct. Pretty much ethics just means right or wrong. That's what ethics are in a nutshell. But morals are what I decide is right or wrong for me. So my ethics and my morals might be very different because the ethics might be guided by the organization, but the morals might be guided by my own personal self and being. So this answer was about morals because it's something that Winnie, personally think this is wrong, but the organization might think it's right. So morals are to do with me on an individual basis. So the question here is about morals, not ethics. And then last but not least, values are what you consider to be desirable in a person. Are they giving? Are they caring? Are they loving? All these are values that you would want to be enforced. And a lot of times when we decide we want to marry someone or be in a particular relationship, be it a friendship or anything like that, it's because we align with their values. Next question. You are caring for Mr. Lee. You are assisting the nurse who was providing wound care. You note that the sacral area has muscle and bone exposed. You understand that A, this is a stage 1 pressure sore. B, this is a stage 5 pressure injury. C, this is a stage 4 decubitus ulcer. And D, this is not your concern because the nurse is providing care. The correct answer is C. This is a stage 4 decubitus ulcer. So before we dissect this question, guys, I want you to know what the sacral area is. This is the sacrum, and this is right above your bum area. So I want you to be able to understand what that is, understand the anatomy and physiology of all our bodies for you to kind of really know. But why the sacral area is important is because, goodness gracious, if you look anywhere, there are so many risks for stage 4 on the sacral area. And a pressure sore is an expensive thing to manage. This is why they love to ask questions about wound care, because they're really hoping that you as a PSW will report a stage 1. What is a stage 1? A stage 1 injury is anything with redness. There are no breaks to the skin, but there's redness. that stage 1 can quickly become a stage 4 if not addressed. If you do not reposition the patient every 2 hours, that can quickly turn into a stage 4. So it's very important for you to make skin assessments, analyze, and inform the nurse in a very timely manner about all these changes. So now at this point, Mr. Lee has obviously progressed and he's now at a stage 4. Because now we see the muscle, but we also see the bone. This particular dressing requires a lot of assistance. An issue too with the sacral dressing, guys, is that a lot of times if you have a BM or bowel movement, or if you pee, maybe that will seep into the wound, so you need to dress it again. I have had patients when I was on a complex continuing care unit where I changed the dressing every 2 hours. As you can imagine, that's a lot of money. And of course, you can imagine the pain that comes into this particular situation. So what we try to do is to prevent a stage 4 decubitus ulcer from forming. Another thing I want you to note is that I use the words pressure sore, pressure injury, and decubitus ulcer. They mean the very same thing. So make sure you know a pressure sore, pressure injury, decubitus ulcer can be used simultaneously. Another thing is I want you to know that there are 4 stages. So B is never a right answer. There's no such thing as a stage 5 pressure injury, right? So just know that there are 4. And finally, just know what a stage 1 is, what a stage 2 is, what a stage 3 is, what a stage 4 is. But D is never appropriate. Never pick an answer that says this is not your concern. If this is not your concern, why are you in the healthcare field? You always have to be concerned about your patients and their well-being. So D is definitely not appropriate. Next question. You are feeding Mrs. Featherstone. She continues to cough as you feed her dinner. What is the next course of action? A, continue to feed her, but give sips of water. B, continue to feed her, but give smaller amounts. C, stop feeding her. You think she's full now. D, inform the nurse immediately. So the correct answer is D, inform the nurse immediately. When I typically see this particular question and then the answer has informed the nurse, I always tell people 80% of the time that is the right answer. But still, I want you to read the question just to be sure that, you are actually answering the question. Because like we discussed in the first video, sometimes you get a lot of right answers, but you want to pick the most right. The most right is the one that really is applicable to the scenario that you have been presented with. So in this case, the answer was D, inform the nurse. So let's look at this further. Let's really visualize this. So let's say you're feeding Miss Featherstone and she keeps coughing. For you to say she's full now, that has no correlation. Just because I'm coughing when I'm eating, it has no correlation with me being full. So that is not appropriate. Continue to feed her but give smaller amounts? Maybe. But that's definitely not the most right. Because she looks like she's actually having dysphagia, which is difficulty swallowing. So why would you continue to do that? This is where you need to tell the nurse, and the nurse will possibly tell a speech and language pathologist who is an SLP that, hey, could you make an assessment on Mrs. Featherstone? Maybe Mrs. Featherstone needs thickened fluids. Maybe she needs pureed food. Maybe she just needs a total dietary modification. This is not in your scope to decide, guys. You cannot just start thickening fluids without getting that input. So what you do is you inform the nurse, and then the nurse will allow the SLP to make an assessment. Once this is done, you will understand the new diet that this particular patient deserves. And A, continue to feed her but give her sips of water. Also not correct. There's so many dangers to giving sips of water if someone has difficulty swallowing, because what if the water goes down the wrong way? This is what results in aspiration. And as a result, you could give Mrs. Featherstone pneumonia, aspiration pneumonia, because you decided to continue to feed her when the signs were right there that she is coughing. So always inform the nurse. If the nurse says it's okay, guess what you do? You go on the progress note we spoke about earlier. You document Mrs. Featherstone was having difficulty swallowing, coughing noted. Inform the nurse. The nurse stated it is okay to continue with the feeding completed. In this way, you are also covering yourself, and it's always very important to do that. You need to understand that a file can stay open for 10 years and you could be called in court over something you did 6 years ago, even when you don't remember the patient. So documentation is always the number one way to cover yourself. So always document, guys. It's very important. So in this particular case, you have informed the nurse, you've done your job. Next question. At what stage does an individual learn differences between genders and understand right from wrong? A, toddlerhood. B, middle childhood. C, late childhood. Or D, preschool. The correct answer is preschool. So preschool is that age between 3 to 5 years. We also call this early childhood. This is the stage when children learn to play with others, learn differences between genders, and understand right from wrong. Toddlerhood are those little cute children we have who are between 1 to 3. Middle childhood is when children develop peer groups, when they learn, and this is from 6 to 8. Finally, late childhood is that final stage just before you become an adolescent, and this is 9 to 12 years of age. Are these ages important? Absolutely. Would you get a question like this? Absolutely. A lot of people overlook the ages and everything, but they do ask these questions because they just want you to understand when you're working with a patient of a particular age, what's really processing in their brain. So these things are very important for you to know. Next question. Which of the following is true about the cardiovascular system? Select all that apply. So always read a question 3 times because I do not want you to miss a select all that apply by only picking one. If you get to select all that apply, you know maybe there's more than one answer. Let me read it a little bit more. A. Blood removes waste products from cells. B. The left side of the heart pumps unoxygenated blood. C. The right side of the heart pumps blood to the rest of the body. D. The heart has 3 chambers. And E. Arteries carry oxygenated blood and veins carry deoxygenated blood. The correct answer, A and E. So I always like to look at diagrams when it comes to the cardiovascular and respiratory system. And I'm hoping you do get into that. So even if you just go on Google, you say cardiovascular and respiratory, you can actually see the difference, right? So these particular, I will say, systems are very complicated, but you also need to understand what the right side is and what the left side is. So the right side always carries unoxygenated blood or deoxygenated blood. This is blood that has been pumped, like the oxygen's been deposited to the rest of your body, and now it's coming back and it wants to go to the lungs to get more oxygen to continue the process. This happens in real time and it's fast. So what you need to know is that the right side always has unoxygenated blood, and then it goes to the lungs where it gets oxygen. Once that's done, it then goes to the left side of the heart, which pumps it out. As it pumps it out, it goes to your system and continues to deposit the oxygen. However, there's certain people who have particular conditions, such as congestive heart failure. So maybe the blood's not pumping effectively. Now you're going to end up with edema, or maybe your heart, ventricles are very, very thin and they're not able to pump as much blood as possible. And now you have a lot of blood pulling back into the lungs. Now you have pulmonary edema. I don't want to confuse you, but what I'm saying is this could go wrong very, very quickly. So what you need to know is the purpose of the blood is to remove waste products, but also arteries carry oxygenated blood. And I always remember that because A and O are vowels. So I always know that, arteries are oxygenated, and then of course the veins are deoxygenated. So you have 4 chambers in your heart. You have 2 atriums, the left atrium and the right atrium, and 2 ventricles, the left ventricle and the right ventricle. So the correct answer was A and E. Next one. What is the leading cause of death, injury, and hospitalization among the elderly population? A, malnutrition. B, cancer. C, falls. D, burns. The correct answer is falls. So if you think about the older population, there are a lot of things that happen as you age. Your eyesight decreases, your mobility also decreases. Maybe now you need a walking aid like a walker, or maybe you need a wheelchair. Maybe you really love to have that throw rug in the home, but that throw rug can pose as an actual risk, right? So these particular things can increase the risk for falls. Maybe you needed to go see the optician, you needed that eye or vision test, but because of COVID, you just didn't go. So now you can't see properly. So you cannot see that, oh, there's a chair right there. And then you fall over the chair. Now, because your bones are just so weak and you have osteoporosis, now you have a hip fracture. Now, because you had that hip fracture, now you need a physical therapist to assist you. Now, because of that, you're probably in the hospital. Now, because of that, there's a lot of stress in your family. Your daughters and your children are worried that will you recover? Now, because of that, the house is being taken care of by strangers. So just think about what a fall could lead to. There's so many complications, so we always want to prevent falls as much as possible. What do? We always assess the area, like are there any throw rugs, are there any mats, are there any things that could possibly cause a fall? And if you decide, guys, to change the way a room is, for example, if you decide to move a couch out of the way or something like that, always inform the patient because they probably used to their house a certain way. So if you move a particular piece of furniture, they might not know, and that could also lead to a fall. Even though you're trying to prevent a fall, you could lead to a fall. So it's very important to note that as well. But overall, there is a high risk of falls among older adults. The normal changes of aging are poor eyesight, poor hearing, and these can most likely lead to a fall. Illnesses and physical conditions can affect strength and balance. Poor lighting or throw rugs can also be contributing factors as well. Next question. You have placed Mrs. Leo in a restraint. She is very calm, so you decide to check on her every 2 hours because she's calm, right? A, there are no issues. You can confidently make this decision because she is calm. B, ensure you give her water while she's in the restraint. C, this will make Mrs. Leo prone to muscle atrophy and incontinence. D, restraints should be checked every hour. The correct answer is C. And the only way you would pick the right answer is if you understand restraints. Restraints are the point where you put a restraint. Firstly, you need a doctor's order every 24 hours. It is very important to know that we try our best not to put any patient in a restraint. In fact, a bed rail, if you raise all of them up, can serve as restraints. So we want to try and prevent that because that could cause injury. A lot of times, if you put 4-point bed rails up, meaning you have bed rails up at the top and at the bottom, a lot of patients feel very constricted. It's like false imprisonment, and they want to get out of the bed, and typically they hurt themselves. They might put their leg in the bed rail. They might jump over the bed rail, and you find them on the floor. All of these are injuries that we try to prevent. So typically, if someone has a restraint, we check on them every 15 minutes. So your decision to check this person or this client every 2 hours was not a good decision. You do not have the right to just change your mind because somebody is calm. You always need to follow a care plan and ensure that you provide the most optimal quality care and follow evidence-based practice. So A is definitely not correct. You do not have any right. It is not within your scope to decide how and when you want to do something. B, give her water. Water is important, but that is definitely not the most right answer. C, this will make Miss Leo prone to atrophy and incontinence. Correct. So, if you use restraints, it can increase the risk of falls, like we said, skin tears, agitation, disruptive behavior, incontinence, and muscle atrophy. All these things are things that we need to watch out for. That's why we make those 15-minute checks. Restraint should be checked every hour. Again, wrong answer. It's every 15 minutes. You also assess for other things such as color, warmth, sensation, and movement. So once you see any issues, please inform the nurse right away. All right. So next question. What is true about COPD, which we also call chronic obstructive pulmonary disease? Select all that apply. A, refers to chronic laryngitis and emphysema. B, it is a chronic condition. C, smoking is a common cause. D, it is important to tell patients to decrease fluid intake. E, there is a high risk for RTIs or respiratory tract infections. The correct answers are B, C, and E. So firstly, what is chronic obstructive pulmonary disease? It is something that is chronic. Chronic meaning it's there for a while. Like blood pressure, for example. Hypertension is definitely chronic, right? So A was wrong because it consists of bronchitis and emphysema. There's so many pictures on COPD, guys. If you look at it, you'll even see the bronchitis. They'll even have like a diagram of the bronchial, and you'll see like all the stuff coming out of the bronchial. And then they'll show you what emphysema is, where, you know, the alveoli is like this big sac and it can't really release air. Beautiful pictures that can really support your learning. So why the A was wrong is because they said laryngitis versus bronchitis. So just in case you didn't watch the first video, we did talk earlier about prefixes and suffixes. So a suffix is what comes at the end of a word, and a prefix is what comes at the beginning. So a very popular suffix is itis, I-T-I-S. This always means inflammation. So you always look at the beginning of the word to see, is it inflammation in the bronchial, which is bronchitis? Is it inflammation in the larynx, which is laryngitis? Is it inflammation in the appendix, which is appendicitis? Is it inflammation in the kidney, which is pyelonephritis? I could go on and on with the itises, but as long as you know that itis means inflammation, you'll know that, okay, this person's not going to be well. There's maybe an association with a fever or something is going wrong. So in this particular case, this person has bronchitis. So now there's a lot of like mucus. So this person's probably coughing pretty often and cannot clear their lungs. Emphysema, now this person has what we call a barrel chest because the air is not able to escape. So now the person has like a barrel chest shape. So please make sure you also look that up to support your learning. Because the secretions are so thick, it is important to encourage fluid intake. It is also common for people with COPD to receive oxygen and breathing exercises. Like I said, you're trying to clear it and it's difficult to clear. The air is not coming out. So yes, you definitely need oxygen and you need breathing exercises. So we already said it's chronic, and the word chronic will already tell you that. So B was an easy one, a nice one. But C, smoking is a common cause. And D, we already said that's not it because you want someone to increase fluid intake. And last but not least, because everything just stays in the lungs, a lot of fluid, a lot of mucus, there's a high risk for infection. All right, next question. Mr. Smith is about to have surgery. You have established rapport with him. He has questions about the surgery. You have worked on the unit for the last 10 years. What do you do? A, tell him that asking too many questions will cause anxiety. B, refer him to the nurse. C, answer the questions you know and leave the rest for a nurse. And D, you have so many years of experience, so answer the questions. So the answer is B. And this might be difficult for somebody to understand because you're thinking, I've worked here for 10 years. I probably know the answer. But again, you always need to go by your scope of practice, guys. I don't care if you maybe even feel you know more than the new nurse who just got their job a week ago. It's still not in your scope. Client education is not your responsibility. It's not in your scope. So you refer this person to the nurse. And A, don't say to someone, oh, you're asking too many questions. You're going to be anxious. They're asking questions because they are anxious. So hearing the answers will definitely relieve their anxiety, right? So the correct answer here was B, refer him to the nurse. Next question. Your diabetic client asks you to cut his toenails. What should the PSW do? A, cut the toenails as requested. B, inform the charge nurse. C, make a visiting family member cut the client's toenails. Or D, make an appointment for the client to see a podiatrist. The correct answer is B, inform the nurse. Now, I know you're thinking, this is toenails, I got training. Look at the question again. It's a diabetic client. You never cut your toenails or the fingernails of a diabetic client. This is why. High blood sugar levels from diabetes can result in nerve damage. That's also called diabetic neuropathy and loss of feeling in the feet. An untrained professional may accidentally cause an injury, such as a cut or ingrown toenail, during nail trimming. Because of this, diabetic patients typically have impaired circulation and wound healing. So even the small cut, guys, or the sore or the ingrown toenail, all these things can lead to infection. This could also lead to gangrene. If you remember that really black toe or that really black foot or that really black area that needed to be amputated. So because you were being so sweet and so overzealous and cut your diabetic client's toenails, then it resulted in an infection, it resulted in gangrene, and now they need to be amputated. So always inform the nurse. These things are very, very challenging. Even for me as a nurse, I do not have any training to cut a diabetic patient's toenails, guys. I typically go to a person who is also a nurse, but trained in this particular field, because I am not going to do that. So this is definitely not in your scope. So gangrene does not get better. It will result in an amputation 9 times out of 10. So always inform the charge nurse to allow them to make a decision. Next question. Which of the following is true? Select all that apply. A, most people with mental health disorders must be admitted into a hospital. B, mental health disorders are typically one's fault. C, mental health disorders are not as important as other health concerns. D, medication and physiotherapy are a part of the treatment plan. And E, chemical imbalances in one's body may result in mental health disorders. So the only answer that was correct here was E. So let's go through them. First one, most people with mental health disorders must be admitted in a hospital. It's very difficult to say they must be admitted because a lot of people with mental health disorders are outpatients, meaning they just get treatment from outside. They don't have to go. So always be very careful with these, like never, always, those type of questions. They always lead to issues because now you're making a judgment that, oh, you have a mental health disorder. You definitely must be admitted. Anxiety is a type of mental health disorder that's treated very well if you do CBT and take your medication. Depression's another one. So always gonna be in a hospital. So that's why that one is not right. B is definitely not correct. Mental health disorders are typically one's fault. How is it my fault that I have a chemical imbalance? This is the stigma that we talk about. So that is definitely not correct. C, mental health disorders are not as important as other health concerns. Most definitely they're important. I will even say more so because of the stigma and the fact that sometimes people have more acceptance of, oh, I can see that you were hurt. I can see that you have a wound versus, oh, what is going on mentally, because it's so hidden, but it's so important. If you think of the high risk of suicide or just the high risk of not being able to adjust to society that comes with mental health disorders, you would definitely know that it is important to treat them. D, medication and physiotherapy are a part of the plan. Medication, yes, but physiotherapy, remember we spoke earlier about the PT, the physical therapist? That has nothing to do with this, because we spoke about the physical therapist who's helping you after an accident, after a fall, or whatever the case may be. So I would not say physiotherapy. That's why that is wrong. But medication is definitely a part of the treatment plan. So let's see what it says. You need to avoid words such as always, never, etc. What I mean by that is if you see that in the question, always or never, that answer is definitely not right. Because there's no absolute in anybody's life or in healthcare, right? In this case, to say they must be admitted into the hospital is incorrect. Not all people with mental health disorders have to be admitted. Most patients receive assistance as outpatients. Having a mental health disorder is a chemical imbalance and it is not one's fault. Physiotherapy is appropriate after a fall or surgery, for example. There is no relationship to a mental health disorder. Mental health disorders are very important and should not be minimized. It is important for you not to stigmatize patients with mental health disorders. Okay. How do you check one's orientation? A, Mrs. Smith, do you know where you are? B, Mrs. Smith, what would you like to wear today? C, Mrs. Smith, can I take you for breakfast now? And D, Mrs. Smith, I will be working with you today. The correct answer is A, Mrs. Smith, do you know where you are? What is orientation? Orientation is where you refer to a person to see, do they know where they are? This is something you do when you're checking it with someone who has dementia, or maybe not even. It's just something you do with your patients every single shift, every single day, because this is an example to see if someone has got delirium, for example, or if their dementia is progressing. So, when working with patients with dementia, it is important to note if they're alert and oriented. Alert just means I'm awake. I'm conscious. I am not that unconscious patient who you have to do mouth care or oral care for with a mouth swab, for example. I am actually awake. I'm conscious of my surroundings. I might not know I'm in Milton. I might think I'm in Africa. But I for sure know that I'm okay, I'm awake, you can see me, I can see you smile, you see me smile. I am awake. But it doesn't necessarily mean I'm aware of where I am. You could say, Mrs. Smith, do you know where you are? And she'll say Poland. But she's in Canada. Mrs. Smith, do you know where you are? I'm in my home. But she's in a long-term care. So ma'am, another thing like to do with oriented to person is ma'am, what's your name? So if I say my name is Mary, then I'm not oriented to myself because my name is not Mary. My name is Winnie. Place. Do you know where you are? Time. Do you know what year it is? If I say 1982, I'm not oriented to time. I'm probably thinking of when I was a little kid playing with my mom and my siblings. So already, these are the types of questions that you ask for orientation. Mrs. Smith, what would you like to wear today? That's just giving her an opportunity to just discuss what she wants to wear, right? Mrs. Smith, can I take you for breakfast now? This is a close-ended question. It's either yes or no. Mrs. Smith, I'll be working with you today. That's just you going and meeting Mrs. Smith and introducing yourself. So the only one that was applicable for orientation was A, Mrs. Smith, do you know where you are? There are different ways to assist assess orientation like we said, but the above questions are common ones used. Disorientation is what we know as confusion, is an inability to recall people, time, or places, and this is caused by multiple factors. Sometimes, guys, disorientation or confusion could be caused by moving to a new place. Maybe someone was in their home and now they moved to long-term care and they're very confused. That could happen. Or it could be a medication change. That could happen. Or it could just be a stressor. So there are different reasons for disorientation, which is why it's important for you as a PSW to check orientation. And if you see that there is a change from somebody who's always been alert and oriented, this is something that you would inform the nurse in a timely manner. So guys, thank you so much. This was our final question. I really hope that this was helpful. More videos will be uploaded. And again, please just provide me feedback as to whether you want me to do some interview questions and to help you out with that. Maybe you're fine, but maybe some of you do need that assistance, because sometimes we only focus on the exam, but there's also life after the exam as well. So I'm hoping that this is something you are interested in. Please just send it in the comments below. And please, if you have any other suggestions, let me know. I always check your comments. So have a wonderful time. And if you're going to write in the next few weeks, good luck with your NACC. All right. Thank you so much.